And here are 3 things to know about the battle of the coronavirus as we head into Thanksgiving week. First, the virus is spreading at a rapid pace, and health officials are especially concerned people plan to travel. Since total U.S. COVID-19 cases crossed the 12 million mark Saturday, Johns Hopkins University says at least 177,000 more have been added today. As almost every state battles a new COVID-19 wave, an estimated 50 million Americans still plan to travel for Thanksgiving, defying the CDC's warning. The coronavirus has killed about 1.3 million people around the world, 250,000 of them here in the U.S. Next, the experimental treatment that President Trump was given in the hospital while fighting COVID-19 has gotten emergency FDA authorization. The treatment is an antibody therapy with 2 drugs that are injected through intravenous infusion. The treatment has shown to reduce COVID-19 hospitalizations and ER visits in high-risk patients. This is the second antibody treatment the FDA has cleared for people with mild or moderate symptoms. And here's where we stand on the race for a vaccine. At least 3 vaccines are showing significant promise. Pfizer has already put in a request to the FDA to allow emergency authorization of its vaccine. The company is reporting 95% effectiveness. If authorized, vaccines could start being distributed as early as next month. Moderna and AstraZeneca also have vaccines in the final stages of testing. With the vaccine getting closer to being on the market, we've gotten a lot of questions about who will receive it first. We set out to verify.
With this pandemic, it's no doubt been a long year for everyone. And that's why we're all anxiously watching the latest vaccine news. And on social media, we've seen one question quite a bit. Who will get the vaccine first? And from there, what's the pecking order? Let's verify. Our sources are the Centers for Disease Control and Prevention.
Who is most likely to get this vaccine first?
And Dr. William Schaffner, who spoke with our team on Facebook Live Thursday evening. Schaffner is a liaison representative for the CDC's Advisory Committee on Immunization Practices, which is made up of medical and public health experts. The CDC makes vaccine recommendations based on input from this committee. Schaffner says the committee had a clear answer as far as who gets vaccinated first.
Healthcare workers. Those individuals who have first contact with people with COVID or who might have COVID will receive the vaccine first. This includes first responders. It includes people who work in nursing homes.
So healthcare workers are first. As for which group comes next,
it hasn't been quite decided, may be decided on Monday.
Generally speaking, the CDC says that there are 3 other groups being considered for early COVID-19 vaccination. They are workers in essential and critical industries, people at high risk for severe illness from COVID-19 due to underlying medical conditions, and lastly, those over 65. Dr. Schaffner says that there's still a debate about which group should go next.
Should it be people who are most vulnerable, older persons, people with underlying chronic illnesses? They suffer disproportionately from COVID. Or should it be people who keep us constantly going in society? Long-distance truckers, the people who work in our pharmacies and our supermarkets.
So we can verify the consensus from the CDC's Advisory Committee is that healthcare workers should get the vaccine first. As for who gets it after that, that's still being debated. With your Verify, this is Evan Kozloff.